So if I gave you a magic wand and you could do anything you wanted to with it to change the healthcare system, what else would you do with this all-powerful magic wand?
Gosh, well, first of all, I would really love to actually have a magic wand. Thank you for the question. Um, you look a couple of things. So no question about the reimbursement model. Reimbursement models have to change. We keep talking about it, right? There's so many special interests in the mix that I'm
Hmm.
not sure we actually will ever get there because I'm certainly not the first one to say it. But the reimbursement model certainly needs to change. Medical education, funding of college, funding of medical education in general, residencies, these things all go together. They all go together, right? So we have to be mindful of why should someone pick a career in medicine, pharmacy, nursing school? It's all, again, the care team, right? And who is going to fund that? Where are folks going to work? How do we also serve, when I think of the underserved, particularly rural America? There are so many opportunities to get doctors in those areas, but again, it comes down to reimbursement. I mean, rural America takes care of some of the sickest patients for less money than the rest of the country. And you're lucky if you can even get a doctor to work in those areas. I will tell you, I am the product of rural America. My parents are both physicians from India, foreign medical grads. In the 1970s, there was a physician shortage. So I was born in Beckley, West Virginia. But rural America actually offered foreign medical grads opportunities. They still continue to because they cannot find American doctors that are willing to go into those areas because it all leads back to reimbursement. I also think we are in a place where we have to really elevate the profession and the conversation around science and medicine. You know, if everyone on TikTok is an expert, then no one's really an expert, right? And so we went from really making the profession of medicine a really heroic thing to now a big loss
Hmm.
of purpose and respect and even an interest in the conversation around science. And so I think there's a broader question around regulation, particularly the social media space. You know, Meta can fact check on Monday, and Tuesday they can say, oh, there's no need to check the facts. It's, you know, freedom of speech. And so there's a bit of a dance going on in the regulatory space as it relates to social media. Meanwhile, we now have decades of research telling us that social media has affected the mental health of children. It has caused addiction, gaming like algorithms. And so there's a real health conversation now happening in the media space. And that space is largely unregulated. And then you add this layer of AI onto that. And while I'm
Yeah.
obviously pro innovation, I'm pro technology, there is a health component that I think we never really appreciated in that conversation, but it's starting to become very obvious that that is a conversation that needs to happen.
But if I could do one thing, I would make sure every single person in this country had access to a longitudinal relationship with a medical care team. We can define medical care team broadly.
Sure.
It may be a primary care doc. It may be a primary care doc augmented by technology. It may be a virtual relationship, but some sort of longitudinal relationship. There's really good evidence that says that if people have been in a longitudinal medical relationship for at least 3 years, the cost of treatment goes down, the quality of their care goes up, and the quality of their life goes up. And so if we could somehow take this magic wand and use it so that we could solve some of the things that are standing in the way of that happening.
Right.
Imagine, as you're listening or watching this, that you had someone that for the last 3 to 4 years just cared about you and thought about you and knew you and took care of you, or your mother or your father, and that's the way things were. I think it would start to solve a lot of the problems that we have. Not all of them, certainly, but
Yeah.
it would be the one thing I probably would do.